Simon, quite simply, has TPG lived up to its promise to expand healthcare in developing countries?
Well, as you said, a number of years ago, TPG started a fund, the RISE Fund. It poured several $1 billion into that. It attracted other investors into the fund from the likes of Bono, the Gates Foundation, the World Bank. And yeah, the idea was really to sort of, expand healthcare, high-quality healthcare for countries that needed it the most. And what we've found out is that in many cases, despite investing money in the hospital, they did prioritize profits over patient care. For example, doctors were given very stringent revenue targets in some hospitals, and that's according to documents we've gathered, to staffers, both current and former. And not only that, in many cases, doctors were encouraged to, refer patients, in some cases, unnecessarily to various departments for tests in order to hike bills. So there's a lot of allegations around overpricing that have been carried out inside some of these hospitals. And, this sometimes falls on the weakest. We had one case of a lady who came in from a very poor neighborhood who, according to her bill and family and carers, was overpriced and ended up with an astronomical bill that ended up in quite a terrible sort of back and forth with hospital management to try and get that price down again. So I think these promises have been questioned.
Yeah. I mean, I guess this raises a broader question about whether for-profit hospitals you find it easy to help those that are most in need. Is there somewhat of a conflict between the need to make money, to serve your fiduciary stakeholders, but at the same time serve the original purpose of why you're launching the business in the first place?
Yeah, indeed. I mean, I think if you come in with expectations of making wild profits, especially in countries, where people's earnings are a bit lower, it's a very tough thing to do because your market clearly is very restricted. In a country like Kenya, you do have some very wealthy members of society, but they are restricted to the top 1%, sometimes even less, that people can actually afford these hospitals. And insurance coverage is very weak in places like Kenya, that really you're talking 2-3% of the population. So your ability to access people in rural areas, in poorer neighborhoods, is very, very low, really, at a private hospital. And I think, investors, obviously, when they come in, they have to think about their models. And, this hospital in Kenya, the Avenue Hospital Network, before TPG came in, we do know that they had implemented some measures to expand healthcare to the poor through free medical camps, for example. And when TPG came in, this specific methodology of bringing free healthcare with treatment seems to have stopped.